Being told that I needed a heart transplant was a big surprise to me because I remember them telling me that I needed to get down to Cincinnati, stat, but we were struggling with that.
The partnership between Premier Health and the Christ Hospital has helped facilitate those more advanced heart failure therapies that are needed. Because we have a close working relationship and are truly working together as a team, whenever patients' needs exceed what is available for them, specifically within the Premier area, we can facilitate transfer to and care in Cincinnati at the Christ Hospital, where they can continue to receive phenomenal care. When Shania first transferred down to the Christ Hospital to get the care that she needed, I did follow her case closely and was able to communicate with her and her mom. I knew that it was important for them to have a familiar face that they knew was rooting for them as they established with the transplant team at the Christ Hospital.
We got a call from Miami Valley Hospital. It was late morning. Hey, we have a really sick young lady. Can you take her and transfer? Our answer is always yes. So from the time she hit the door, it was just like a massive group of intense people with anywhere from years to decades of experience, and like me. And we just kind of smothered her with care, compassion, and intensive care.
One of the great things about our relationship, the joint venture between Premier and the Christ Hospital, is we can help transfer patients between the systems pretty seamlessly. We can do that when patients are in the hospital in a Premier facility, or even if they are outpatient, if they have not had to be hospitalized recently. We are able to coordinate between the different systems, have people from both communicate with each other to help get the patients into the hospital or into testing and get what they need so they can get better.
It's a multidisciplinary team, so it's not just one person. It starts with the referring physician, recognizing the patient has heart problems and heart failure and is critical and needs additional help that they can't offer. So the transfer was extremely important to do that before the organs start failing. And then we have the capacity. Dr. Dowling and his group, cardiac surgery group, is extremely proficient at supporting patients with the temporary devices while they wait for transplant, where we can look at them very carefully to see if that's the route to go.
You know, being a referral center, we have all those devices that can pull someone like her through. But, you know, probably the most important point, Geeta's always more spun on than I am. It's such a team approach with the intensive care doctors. And the number one thing that we see that we wish we could change with a magic wand is to have patients come early like she was, before they got irreversible end organ failure. That's so crucial. So again, hats off to the people in Miami Valley for sending her on time, to our ICU team and everybody for recognizing quickly that she was the sickest of the sick. And again, to my surgical colleagues for putting a temporary pump in, and for our transplant team for getting all the evaluation done, getting her on the list, and finding a beautiful heart for her so quickly.
I'm very glad that they pushed me to come down to Cincinnati because without that push, I probably wouldn't have thought that it was really important to come down here. My transplant team, they done a lot for me. I feel like they helped with every little thing that I was struggling with. I'm grateful that they basically held my hand through all of this.